Atrial fibrillation, also known as AFib. This is where the atria is fibrillating, meaning that the electrical signal that's supposed to come in from the pacemaker is not coming directly from that pacemaker anymore. It's kind of chaotic, and therefore the ventricle is acting chaotic, and therefore we get an irregular heartbeat. This can be denoted by even now your phone on your watch, or even your apps on your phones, or you can even denote this by, of course, confirming with an electrocardiogram. Now, there are different things that you can do to avoid atrial fibrillation, and there are many reasons as to why you have atrial fibrillation. But atrial fibrillation can come from many different sources. Let's quickly talk about what you can do if you do have atrial fibrillation. If you find out that you have atrial fibrillation, you might feel this rapid pulse happening. At that point, I always prefer to get you back into normal sinus rhythm. And if you do have that, there's a big blog post that I wrote on having atrial fibrillation and what you can do about it. And so when you have atrial fibrillation, you can take IV amiodarone, and then you can get a cardioversion shock to it, and then you can sometimes regulate the heart back to normal sinus rhythm. And of course, it depends on how long you were in atrial fibrillation. But then the biggest key then is to then find out, and if it's more advanced than that, then we can also do ablation therapy, where we can go in there and map out the heart signal, and that's a quite invasive procedure. It's the next stepping stone from doing a cardioversion, where they shock the heart. The ablation therapy is getting a little bit more advanced, and we go in there and it's a long procedure to map out the heart rhythm, and we burn the path as to where we should see the heart rhythm go. So that's the treatment side of atrial fibrillation. But the big concern of why atrial fibrillation is a big problem is because it puts you at risk of stroke. And so imagine the shaker of the atria, it can cause a clot to happen. And when it causes a clot to happen, it can shoot up to the head and cause a stroke or cause a pulmonary embolism or whatnot from that idea. So it's important to keep the blood thin. Now there's something called a CHAD score, where we can determine as to what your bleeding risk is, or what the risk is of you not taking or taking an antiplatelet therapy or anticoagulation therapy, sorry. And so when we look at that part of it, it's important to now look at treatment options. But at the Hartford Clinic, we want to know then, well, why do you have atrial fibrillation? And there are many reasons as to why you can have atrial fibrillation. But we can look at what's going on there, but more importantly, look at your cardiovascular disease risk to see the need or if you do require medications or don't require medications to treat atrial fibrillation. There's lots that we can talk about atrial fibrillation, but if you have any specific questions, comments, or even observations, we're happy to get more in depth as to why you have atrial fibrillation, and then what the treatment options are out there, and what can you do on a non-invasive basis and focus on lifestyle changes to help you with atrial fibrillation. So again, we look forward to helping you with your specific questions and answers, and book a consult or email us, and we look forward to helping you live happier, healthier, and longer.